Well, couples having problems conceiving often turn to in vitro fertilization to get pregnant. A recent study shows using a frozen embryo instead of a fresh one in the process may lead to better results. Our Ivory Hecker talked to one couple who went through the process twice and the doctor who is working with them as they try for a third baby.
You're gonna be 4, and you're gonna go to adventure and have a party.
Nathan's birthday is around the corner, but it seems like just yesterday, Nick and Lori Ruff got the call about the baby they thought they might never have.
We got the call, I think it was from Judy, who's one of the nurses here.
And I missed the call. She actually had to leave me a message. And I got back to my phone, I was like, oh my goodness.
But they did the blood work about 2 weeks after the transfer, and we got the voicemail that said, you know, she is pregnant, and we were just thrilled, very blessed to have them.
After trying for 1.5 years to have a baby, Lori's doctor recommended in vitro fertilization. So they went to Dr. Whitman-Elia.
I think everybody grows up believing they have the right to procreate. It's sort of entrenched in the American way of life.
And it was by fertilizing the eggs outside of the body that they had their 2 sons, 2 years apart.
And Nathan was born in 2009. He loves to read. He's going to play soccer this year. Bryson is almost 2. He'll be 2 in May, and he is rambunctious.
We put the woman on fertility drugs, put her to sleep, harvest her eggs through the vagina. Takes about 8 minutes to harvest the eggs. The eggs are then mated with the sperm in the lab.
In Nick and Lori's case, after fertilization, the embryos were frozen in a batch and thawed at different times when the couple was ready to get pregnant.
And they're actually kind of twins because they were both conceived on the same time. Yeah, this one's just 27 months older.
A recent study out of Sweden found that couples like the Ruffs who freeze their embryos before pregnancy tend to have a slightly lower rate of poor pregnancy outcomes than couples using fresh embryos. After 2 successes, the Ruffs are trying for their 3rd.
We just finished a fresh cycle. They froze them today, I believe, today, and we have 10 frozen. So we're gonna come back in a few weeks, I guess, and start another frozen cycle.
Dr. Whitman-Elia says environmental factors, diet, and stress levels can affect a couple's ability to conceive.
Women don't renew their egg supply. We're stuck with what we have. So if a woman is a smoker, she's poisoning the only supply she has. On the other hand, men, because they regenerate their sperm constantly, they can get rid of a bad population of sperm and generate a new population of sperm.
Dr. Whitman-Elia offers this advice to improve your chance of getting pregnant. Keep your eggs or sperm healthy. Don't eat foods that include pesticides or hormones, drink filtered water, and don't microwave with plastic. Also, avoiding nicotine will keep your body as healthy as possible. Ivory Hecker, watch Fox News.
Well, the latest breakthroughs have also allowed doctors to freeze a woman's eggs for extended periods of time until the woman is ready to have them fertilized. Dr. Whitman-Elia explains how that's done on our website, MidlandsConnect.com.